Nelson Mandela Bay's acting mayor, Thsonono Buyeye, believes the metro should return to level 4 lockdown. He's worried residents aren't adhering to lockdown rules. Some experts believe the infection rate in the metro will dramatically increase in the coming weeks. The Eastern Cape currently has more than 26,000 infections and nearly 400 deaths. Mr. Buyeye speaks to us now. Very good morning to you. It's a very troubling situation where you are. Tell us about your calls to raise the lockdown level.
No, good morning, Jane, and to your viewers. I think the question arises from a discussion that we were having with one of the journalists and talking about the spike in numbers in the Nelson Mandela Bay, and which is very worrying. And the fact that recent reports that we have seen that seems to suggest that quite a few government institutions that are closing as a result of COVID cases, like your police stations, clinics, to some extent some hospitals, as well as even the municipality itself. Certain departments had to close as a result of the spike. And so those were but what was more worrying was when we listened to one of the biggest funeral homes in the city, the director of one of the homes saying already the bodies are piling up, and about between 25 to 30 funerals that they are having on a daily basis. And that alone was an indication that even though we are starting the spike, or what we call the crisis period, the signs are that we are not coping as a city. We might not be coping when the real spike comes. We've seen recent reports of people lying in passages in hospitals, and that those are worrying signs. And if nothing is done urgently and extreme precautions are taken to limit the transmission, we're going to be in a more serious situation. So we need to do something drastic to make sure that we fight back against this virus. And you know, during the lockdown period, the rate of infection, I think it was very controllable in the city. But now, since we've entered lockdown level 3, the spike is just going up and up, and we do have. We've just opened the stadium.
I know you're also very concerned about how people are behaving at the moment, not taking this seriously at all.
No, that is a fact. That is a fact. If you walk around the streets, and the attitude does not seem to suggest that we're in a crisis period, and we think we have done all we could, but even though we are still going to make sure that we continue doing that to give away, to send a message out there that people, even though we are in level 3, but we still need to do the basics right. We still need to make sure that we wear our masks, and currently that is not really what is happening. We must regularly wash our hands, keeping off the social distance. Those are some of the 3 major things that we should be doing on a daily basis without even wanting to be policed about that. We don't need police, we don't need any health workers to tell us that. It's something that we should know, because almost all of us now at some stage we have already seen people that we know who have been victims of this coronavirus. It's no longer about numbers now, it's about people that we know. Even the mayor's office, we've already lost somebody in the mayor's office, very close, somebody that I was working with. And so those are signs that this thing is real, and we need to take drastic measures to make sure that when the real spikes comes, we are in a position to handle the crisis. And currently the signs are saying that we might not be in a position to know when, for an example, the funeral undertakers are already saying the numbers are growing, and they are
Let me jump in here.
They might be running out
I'm sorry to hear about the loss.
Spaces for bodies. Yes.
I'm sorry to hear about the loss in your office, but I'm just wondering what the challenges are to pushing this up another level. How much buy-in you'll be able to get from local businesses?
No, we understand, and that is why we are saying it's a delicate balance that we understand, because as much as we would want to save lives, but also the other concern is that whilst we might not be corona positive or infected by corona, but we might die of hunger, and that is a reality. We understand the poverty levels in our city. To a certain extent in the whole country, we understand that and unemployment is very high. People are losing jobs. That is a fact. But at the same time, the economy also needs to operate, to be operational in the city. Those are things that we say it's a difficult balance to make as to which side you go. I understand the president when he say it's not a decision that must be taken very lightly. Hence, I'm happy that it's not my decision to make whether we go back to level 4 or to stay on level 3. Mm-hmm. It's a national government that must make the call, but we believe that there's something drastic must be done to make sure that our people have somewhere to go when. Because even the beds currently, it's been reported that there's a shortage of beds, especially in high care and ICU already. And we are lucky that tomorrow, one of the field hospitals that we've opened recently, donated by VW South Africa, will open.
All right, Dr. Mayor,
I think that will also.
We're losing your sound. Good to talk to you this morning. Thank you.